Hi, welcome back to my YouTube channel. I'm Dr. Fatma Salim. I'm here to educate patients as well brainstorm with my fellow colleagues on how to offer quality healthcare services. Kindly subscribe, like and share greatly so that people can benefit from this knowledge that I share with you. Thank you. Please do not forget to press the notification button so that you can be notified every time I upload a new video. Thank you again. Well, on this video today, I would like to address on issues to do with misuse of drugs. But before then, I would like to explain on what happens once we take the medication to the time it is excreted from our body. I believe you all know that there are different ways on how we take medication or on how the medication enters our body, such as through the mouth or through the intravenous or just topical medication. Well, for tablets, once we take them in our body, what happens is it goes directly to the tummy, to the stomach. Once it's there, then it's taken to the liver, and then it is processed and all that and all that. Anyway, so to say, there are four processes that are involved in this. One being absorption, on how the medication or how the medicine enters the bloodstream once it's in the stomach, and then distribution on how the medication is taken to the targeted site from the bloodstream, and then metabolism on how the medication is inactivated in the liver or lungs or kidneys. Well, the last one is excretion, on how the medication is taken out of the body through kidneys. It can be done through sweating, and some are done through fecal matter. It depends on the type of medication and the mechanism that's in place. Well, knowing that, in developing countries, apparently over-the-counter medication is a common practice. Not so many drugs are restricted, especially when it comes to painkillers, antibiotics. These days, you can just, it has been there. It has been a practice that you can purchase them from pharmacies, or you can even get them from the shops, especially painkillers. Well, patients have been taking advantage of that, and there are patients, as we're talking, who cannot sleep a day without taking painkillers. Well, before that, let me explain to you that the body has its own self mechanism of dealing with pain, managing infections and all that. These medications that we take are actually a top up, or sometimes when the body is is too weak to manage a pain or to manage an infection, then we take medication so that we can actually accelerate the function. Well, there are people who are misusing these drugs, so to say, where people are misusing these drugs, and there's some effects, people are misusing these drugs without knowing the consequences, and the consequences usually come later when it is too late. Patients do not know why they are feeling ill, or their kidneys are not working, their livers functions are impaired and all that, because taking these medications every day, you can imagine the liver is the one that processes most of the medication. Literally, the liver is the primary organ that receives these medication and process them. So if you are taking medication every day, you can imagine how much how much you're burdening your liver and the kidneys, so to say. So taking these medications, just buying medication over the counter, it is okay, but only when it is necessary. You should only buy medication when it is necessary. Very vital that you cannot manage the pain and all that. Sad enough to say that people these days are so much dependent, or have become addicted to painkillers, addicted to antibiotics, in the sense that they cannot do without them. They cannot. A simple thing, they rush to painkillers. People cannot sleep a day without taking painkillers and all that. So they're literally burdening their livers, burdening their kidneys, and at the end of it all, they get to have impaired functions of these organs. And it's then that they will be wondering on what happened and all that, you know. So to say, these medications are toxic to the liver, especially if you overuse them, you know. Literally, the body has a self mechanism of dealing with pain. Not all headaches require a painkiller. Not all body aches require a painkiller. You should literally be sensible enough to know that, oh my God, now this pain is too much for me to bear, so I really need to take a painkiller. I really need to take this medication. What am I trying to say is that there could be different reasons as to why one is having a headache. For instance, maybe someone lacked enough sleep, maybe someone has not taken their daily cup of coffee, maybe someone has not taken their cup of tea, or maybe there's some serious diseases that are involved in that. So you taking this medication, for instance, you have a headache and you take a painkiller, the headache, poof, is gone. And then tomorrow it comes back again, you're taking another painkiller and all that. And meanwhile, you have a serious disease that you're delaying the management, you're delaying it to be attended earlier in advance before it complicates by taking this medication. So you're taking medication, delaying your actual treatment for the actual diagnosis, actual disease that you have, you know. So you're actually collecting a lot of issues which you're actually collecting a lot of issues which you will be difficult to manage in future. All what I'm saying is that one has to be very careful when it comes to taking painkillers or these medications. These days there are a lot of topical medication, especially for those people of old age, suffering from arthritis and all that. Literally, you taking medication every day to subside that pain is actually intoxicating your liver, your kidney, you know. I'd rather, or I would recommend you that you take topical medication. There are sprays which work very well when it comes to pain. There are ointments or creams that, gels that work so well when it comes to managing pain. Kindly do that. Do not expose yourself to a lot of issues, to toxicating these organs, and then later on suffer issues to do with blood dialysis or liver impairment to the point that, you know, you cannot be helped. Thank you so much for tuning in. I appreciate you taking your time to take a listen. Kindly subscribe, like, and share widely so that people can benefit from this knowledge. Don't forget to use your medication wisely. Thank you. Till next time.